In the case of an allergic emergency, every second counts. That's why EpiPen should be used at the first sign or symptom of a severe allergic reaction. Just follow these simple steps. Grasp the EpiPen Auto-Injector with the orange tip pointing downward. Blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of their outer thigh. Swing and push the orange tip firmly into their mid-outer thigh until you hear a click, and hold on their thigh for 3 seconds. Count slowly. 1, 2, 3. EpiPen will work through clothing if necessary. After EpiPen is used, the orange needle cover will automatically extend to cover the needle. This safely covers the needle as the auto-injector is pulled away from the thigh. You will not see the needle before, during, or after use. The extended orange needle cover and black indicator in this window will show you that EpiPen has delivered its epinephrine. Remember that using EpiPen does not replace seeing a doctor or going to the hospital. Anyone receiving an EpiPen injection must seek medical attention immediately. The effects of epinephrine can wear off, or a second reaction could occur. Call 911 or take the individual to an emergency room right after using EpiPen. If symptoms continue or get worse, you can use another EpiPen or EpiPen Junior 5 to 15 minutes after the first dose. Do not inject more than 2 injections right after each other. Remember to bring all the used EpiPen auto-injectors with you to the hospital. Give them to a healthcare professional for inspection and disposal.
This video will show you how to use the AviQ injection system. First, take the AviQ out of the case. Remove the red safety guard. You can give the shot through clothing or directly into the skin. Place the AviQ against the outer middle part of the thigh. Press firmly until you hear a click and hiss sound. Hold it in place for 2 seconds. Call 911 so you can be taken to the emergency department by ambulance for follow-up care. Use a second AviQ if the symptoms are not better within 5 minutes.
To start, get your auto-injector and sit down if you can. You can also inject standing up. It is okay to inject directly on the skin, but if you cannot access your skin, you can give the injection through your clothes. Do whatever seems best in this situation. Remove the auto-injector from its tube-like case, like I already have. Place the auto-injector in the palm of your hand and wrap your hand around the auto-injector like a fist. Do not put your fingers or thumb or hand on either end of the auto-injector. Pull off both end caps, this one and this one. Make sure to point the red end downward. The red end contains the needle. Place the red end of the auto-injector against the middle part of your outer part of your thigh. Push the auto-injector firmly onto your skin. You want to hold it tightly and firmly in place for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The injection is now complete and you can remove the auto-injector. You will still be able to see the needle. Be careful. Massage the injection area for 10 seconds and call 911. You'll want to carefully cover up the needle using your carrying case. Place the needle end into the carrying case and then put the cap on. That way, you'll protect yourself from being pierced with the needle.